Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. In the city of Mumbai, the focus now is clearly on the overstretched and overwhelmed health infrastructure. So far, the burden of responsibility has fallen on the public health system, but now private hospitals are also going to be requisitioned. With us here is Dr. Sudhakar Shinde. He's the senior-most bureaucrat who's actually spearheading the state government's response to the COVID crisis here. Dr. Shinde, why is there this crisis in Mumbai, which we are not seeing of the kind in other cities, where public hospitals are struggling? We have personally met patients who basically say that we need a bed, we don't have a bed. There's a clear shortage of beds. Even in small private hospitals, I met a doctor who said every day we are turning away 50 patients. What's happening?
So in Mumbai, the city has its own peculiar features. City is one of the most, the city which receives maximum number of international passengers, and the city is connected to almost all parts of the world. So it had its own reasons. So we have got more number of cases. But looking at this patient load, now government has requisitioned all private hospitals. We have our flagship scheme called as Mahatma Jyotiba Phule Jan Arogya Yojana. Now it is being augmented with Pradhan Mantri Jan Arogya Yojana. And in this scheme, there are 1,000 hospitals which are on our panel, which give treatment free to the people. But looking at the future figures and projections, we were in dire need of getting more beds from the private hospitals. When we looked at the private hospitals occupancy, we found that there is a lot of space and we need to regulate the rates, because what we notice that some hospitals are providing care to the COVID positive patients like holiday packages. Some hospital is giving 30,000 rupees per day for asymptomatic patients. So now our biggest challenge is to balance between the patients who are COVID positive and who are actually needing the treatment. Like somebody who is asymptomatic and who is fit for our home isolation policy, we request such patients to take all abundant precautions and observe home isolation at their respective residences.
But this line that you use, that some private hospitals are offering packages like their holiday packages, can you elaborate on it? And come, we'll walk. We're in the area of Worli, which has been in the past one of the most badly affected areas. So what do you mean by holiday package?
So these hospitals are having like all package inclusive of the bed charges, then the nursing charges and doctor's charges. So they were charging some 17,000, 20,000, 30,000 rupees. So now the question is whether these beds are to be occupied by people who are not in actual need of the treatment, and can we open these beds to patients who actually need and who cannot afford?
Are you suggesting, if I may use the phrase, a certain kind of hospital bed hoarding?
I will not say hoarding. The beds are occupied by the patients, but now we have to prioritize.
So they may be blocked by people who don't really need them badly.
Yes, they can be, and the only way to do it was to make the demand and supply meet at the correct price. So government has stepped in and regulated the price.
Now, I saw that your notification has capped the prices, and a number of patients we met in small hospitals said that private hospitals have been overcharging. What has been your finding? What were the kind of rates, and how are they different from the public health rates?
Yeah, although some hospitals are doing good work for the people, but we found many grievances, many complaints from patients who were overcharged. Like some hospital in Mumbai had charged some 26 lakh rupees to some patient for 10 days. Some hospital has charged 20 lakhs, some has charged 15. So these are very exorbitant bills, and I think they cannot be borne by even a upper middle class person.
That's right.
So we had to step in, and government was very insistent that we need to regulate it. And yesterday we have issued a notification and we have regulated it.
How have the private hospitals responded? I know you've been extensively negotiating with this, and why is it that in Mumbai the public health system has carried the burden? And I'll give you an example. We were reporting from Sion Hospital, and of course there were all those viral videos of the bodies lying next to the patients, but the doctors we spoke to there said we are feeling very judged. You have no idea how overwhelmed we are.
Absolutely. I think the public health infrastructure is the backbone of today's corona treatment, and they are doing their best. But looking at the patient load, we had to take help of some private players, and now I think we'll get some good.
Are you disappointed with how private hospitals have behaved?
They have their own reasons, but
what are those reasons? Profit?
Not only profit, they have their own policies, they have their tie-ups with other corporate groups, they have their tie-ups with GIPSA and TPA. But when we talked to them, we had a couple of meetings with them. I think they are now on board, and they will give their due to the public.
What is the biggest problem you're facing, and why would you say that there is a shortage of beds? I'm actually noticing we're standing, if the camera pans here, we're standing next to one of the sort of Christian sites here in Worli, and I noticed this because I was reading that a lot of these private hospitals actually fall within charity hospitals, which means that they are obliged to assign a certain number of beds for poor patients and those who really need them. What did you find? How many of these beds in private hospitals were vacant?
Many of these beds were vacant.
What percentage? About 80% is what some reports suggest.
I read some reports which suggested that more than 80% of such 20% obligation beds were vacant.
Yes.
Moreover, we also realized that not only the charity beds, but even the total number of beds occupied were very less. So we had to take their help now, and I think they will support this government's notification. Also, Barka, there were many issues faced by private hospitals. They were very genuine issues.
Like?
They face that if government caps the rates of treatment, then there are some doctors who will still keep on charging their own original rates. So we have issued in our notification that doctors will have to provide services at the rates given by the hospitals within these packages. So now this is a crisis time, and we need help of all stakeholders. Let it be doctors, let it be staff, let it be nurses, let it be the visiting consultants, and everybody has to cut down the cost so that the ultimate beneficiary, the patient, gets the treatment in the affordable cost.
Do you think the private hospitals should have been requisitioned earlier, much earlier in Mumbai? And I ask this because the lockdown was never going to send away the virus. You're a doctor, you're also a bureaucrat, but you're also a doctor. You know that the lockdown was meant to prepare the health system. Why do you think the private hospitals in Mumbai were not requisitioned earlier?
I think private hospitals were requisitioned much
But many of them were closed. You also saw you had to issue notice to them to open.
Government has requisitioned those hospitals. Many private hospitals were converted into dedicated COVID hospitals. But as and when the patient load increases, we have to expand ambit of our regulation. And now maybe tomorrow, if we need some more, we'll have to increase this cap from 80% to maybe 100%.
What is the biggest challenge you're facing? And we all know now that the more you test, the more number of cases there will be, right? So that we have to accept. But equally, you can't keep a country under lockdown. But Mumbai is a different kind of city because many people live in highly congested areas, in slum tenements and chawls. So what is the problem that you're facing going forward here in Mumbai? Why is the health infrastructure so overburdened?
So looking at the nature of the city, the number of cases are going to increase because people are not observing lockdown properly. There are small houses people are staying. It is not possible to maintain social distance at all times. But I think government has done its best, and we have ramped up our own infrastructure. We have roped in many hospitals in our Mahatma Jyotiba Phule scheme, and now this this regulating private hospital beds will cater to all the needs of the city.
Your insurance plan, talk a little bit about that.
See, Maharashtra has its flagship health insurance scheme, Mahatma Jyotiba Phule Jan Arogya Yojana, since 2012. This scheme till recently covered around 85% of state's population, but since last week government has declared to expand its cover to almost 100% of the citizens of the state. So this is the first of its kind in the country. Like state like Maharashtra, who has population of more than 12 crores, is going to provide free and cashless health insurance facility for more than 1,200 illnesses in the state. It also covers treatment of corona. We have 1,000 hospitals on our board, and we are catering to almost all treatments in other parts of the state. But in cities like Mumbai and Pune, we need help of some private hospitals.
One last question. What keeps you up at night? There is something that keeps people sleepless at night. What is that for you?
So since last week, we were facing this issue to regulate this. So we were in negotiations with the hospitals, and we were thinking how to regulate it. So getting the balance between the demands of private hospitals, their constraints, and demands of the city, that was quite a issue with us, but I think we have resolved that issue.
Well, good luck, Dr. Shinde. It's not an easy task. You have one of the country's most difficult jobs right now. We wish you all the best.
Thank you so much.
And Sudhakar Shinde, they're making the point that private hospitals have finally been requisitioned, their fees have been capped. But when all of this is over, one of the things we should think about, people of our class, we're so judgmental about government-run hospitals. But through this crisis, it has to be said, it's young doctors of the public health system that have literally carried the cross in helping patients deal with this pandemic.